Hi folks, today I'm going to show you a magical MET that will balance out a high hip. If someone has a high hip, they could experience low back pain, pain down the legs, sciatic nerve pain, pain all the way up to the head, all the way down to the toes, and this one little simple MET could help change all of that pain. As you may know, the quadratus lumborum is the main muscle involved in a high hip. So today I'm going to show you an MET for the quadratus lumborum. So it balances out the hips and all the way down the body and up the body. So the first thing we do is we assess to see if someone has a high hip. So today I brought in my assistant, Shalane, who's also my partner, and we're going to assess her hips. So the quadratus lumborum is the main muscle involved in a high hip, and it runs from the base of the ribs, the last rib here, all the way across to the spine and down to the iliac crest, right across here. So as you can see, that could pull a hip up if it was tight. So let's assess her hips. You want to have one hand on top of one iliac crest, just like this, with the finger straight out, and then have the other hand on top of the other iliac crest with the finger straight out. As you can see here, the right hip is slightly higher than the left hip. That is how you determine if you have a high right hip. Again, this also could create pain down the sciatic nerve, down into the sacrum, and into the low back. So in order to balance out a high hip, you have your client lay on the side of the high hip. So in Shalane's case here, she had a high right hip. So she's going to lay on her right side, facing me. So she's laying on her right side facing me. She's going to come a little bit closer to me. And her knees are going to be at 90 degrees and her hips are at 90 degrees, just like so. She's had this done before. So what we do is we place our fingers at the base of the spine here at the sacrum. So the spine is here. My finger is going to be on the other side, not up here, down here. So I'm going to have one finger at the sacrum and the L5, L4, L5, L3, L4, and L4, L3, L2. Just like so. Then we're going to have our hand, our other hand, our caudal hand on the underneath the ankles, both ankles here. Now you're going to get some really good body mechanics, and you're going to just gently lift the feet up to where you feel it under your first finger. So you feel the movement under your first finger here. Then you're going to instruct your client to gently push their foot toward the table, both feet. Go ahead. And you can feel that activate under your first finger. And you hold for 6 to 8 seconds, just like in any other MET. Then you bring the feet up to where you feel it under your second finger. And then you instruct the client to gently push the foot down toward the table. Hold for 6 to 8 more seconds. And then release. And then go to the third finger and bring the foot up just a little higher so you can feel it under the third finger. And instruct your client to push down gently toward the table. And release. And then up to your pinky finger. Go ahead and press down. And release. Now we will reassess to see if her hips balanced out. Now is the moment of truth. Let's reassess. So again, you find the iliac crest on the right side and bring your fingers out straight out from the crest, and then you find the crest on the left side. And you bring your fingers straight out. And voila, balanced hips. Just a simple magical MET to balance out someone's hip, relieve their low back pain, sciatic pain, and any other pain that could go all the way to their head or to their feet. Enjoy your practice.